Okay, this video is Plantaris and Popliteus. Plantaris starts on page 374. Popliteus is on page 375. Let's get going. And here we are. Plantaris is the shortest muscle in the body, but has the longest tendon in the body. So it's a little teeny muscle belly with a long, skinny tendon. Interestingly, Plantaris is one of those muscles that not everybody has. It's absent in roughly 10% of the population, and it is largely thought to be vestigial. In other words, this particular muscle would have been part of a larger group of muscles for stronger plantar flexion. And in other primates and lizards and things like that, they do have those types of muscles for extra plantar flexion. So our Plantaris doesn't really do a whole lot for us anymore. It is weak plantar flexion now. We have gastrocnemius and soleus that really take over those plantar flexion roles. So here's Plantaris, as I said, little teeny muscle belly, long skinny tendon. Long skinny tendon. Your book does mention in this little box down here, it talks about Plantaris being close to a muscle that we have in our forearm. We haven't talked about that yet, so we'll round back once we talk about the forearm. Origin is the lateral supracondylar line of the femur. So this originates very close to one of the heads of gastrocnemius, as you can see. Here's the head of gastrocnemius, Plantaris. Plantaris is palpable, but it is difficult to tell it apart from gastrocnemius sometimes. And we are going to be working more in the popliteal space when we palpate Plantaris, so we do need to be a little more careful. Origin is the calcaneus via the calcaneal, insertion is the calcaneus via the calcaneal tendon. So gastrocnemius, soleus, Plantaris all insert on the calcaneus via the calcaneal tendon. Those three, that's important to know. Actions, weak plantar flexion of the ankle, as I mentioned. Also weak flexion of the knee. It crosses the knee joint, so it has to have an action there. However, since this muscle is so tiny with such a long tendon, it really doesn't have the strength like the other muscles do. But it is there and in most people, so we will just talk about it briefly. Okay. As far as location of Plantaris, it is in the popliteal space, but it's also on the lateral side here, and it runs at an oblique angle. So we may be able to palpate it just because we understand where it is, and it's just above the lateral head of gastrocnemius. Okay, that's Plantaris. Not a whole lot to that one. Pardon me. So then we have Popliteus. Popliteus is has a little bit more to do. It's not vestigial. This one is very, very useful for us. So Popliteus is in the popliteal space, hence its name. This one has kind of a short muscle belly also and a short little tendon, but the tendon wraps around the femur a bit. You can see its placement here. It's sort of in between the head of the femur and the lateral condyle, or head of the fibula and the lateral condyle of the femur. My brain's running ahead. I don't know what's going on here today. Slow down. Okay. Popliteus, because of its action in flexing the knee, is sometimes called the key which unlocks the knee, right there, the key which unlocks the knee. So when the joint itself is in extension, it has a tendency to stay in extension just because of the placement of the femoral heads in the two little C-shaped rings of cartilage in the knee, or femoral condyles, excuse me. So one of the things that we don't want to do is lock the leg in that position because it puts a lot of pressure on the veins and arteries in the posterior knee, in the popliteal space. And you can faint because of it. So popliteus comes in and it unlocks the knee. So it pulls the knee out of that extended position and into a little bit of flexion, hence the key that unlocks the knee. So again, it's got kind of a weird position here. Okay, so this is a side view, right? Here's the head of the fibula, and then the lateral epicondyle of the femur, and then the tendon kind of wraps around the back, and then there's the muscle belly. So let's take a look at the origin and insertion. So the origin is the lateral condyle of the femur. Okay, so right there, lateral condyle of the femur. It's a really small space. The insertion is the proximal posterior aspect of the tibia, which makes sense. Let's look at this splotch here. Proximal posterior, proximal posterior aspect of the tibia. And the muscle belly itself is almost entirely covered by gastrocnemius, okay? You can palpate it though by its action. We can feel a little bit of popliteus when we have our partners flex their knee. Okay. Oddly enough, popliteus actually means ham of the knee, which I think is hilarious. I don't know why it's called the ham of the knee. I guess it looks like a ham hock, maybe. That's my best guess. But popliteus is the ham of the knee, as well as the key that unlocks the knee. You know, makes things interesting. Okay, so popliteus flexes the knee. We already talked about that. That was sort of the whole point of the key that unlocks the knee. But because of its position on the femur and the fact that it wraps around the back of the leg, it can medially rotate the flexed knee. So it's going to pull this whole area this way. Okay, so from here to here, which is going to take the tibia and actually medially rotate it. I know it looks like it should laterally rotate it, but it doesn't. It's going to medially rotate it. Okay, right in there. So the medial rotation of the flexed knee and flexion of the knee for little old popliteus. The ham of the knee. Okay, so let's take a look at these here. Oh, I wanted to zoom in a little, but I think that won't work. So this is popliteus right here. The ham of the knee, apparently. And see, it is going to be covered by gastrocnemius. Okay, on this side, that's all you can see. It's the most superficial. But if you remove popliteus, if you remove gastrocnemius, you can see popliteus here, soleus here, and this one, which is plantaris. Let me move this a little bit. Let me see if I can. Oh, that's better. Okay. So little old plantaris here. Skinny little tendon, and this blue, of course, is indicative of its attachment to the calcaneal tendon here. So little plantaris and little popliteus. They both have attachments on the lateral femur. Okay, you can see here and here. All right, that's it for plantaris and popliteus. Next up, we have the flexors and extensors of the leg.